Well, we're going to end where we began, which is that the youth mental health crisis is not only local, but it is global. And because of the success of what was started here in Greece, and because of remarkable, as I've said again and again, visionary support from the Stavros Niarchos Foundation, we recognize that 90% of all children in the world live in low and middle income countries. And mental health disorders does not discriminate. You can be rich or poor, you can be black or white or yellow or brown. These are disorders that all kids get. However, if you have more burdens, more economic burdens, more stigma burdens, less resources, it's going to be more difficult to address these disorders. We were just talking before about the idea of can't early identification and prevention eliminate some of these disorders? And the word eliminate, I think, is too strong, but there is no doubt if you think about a symptom that's 10 days old. In fact, here's the best one. You develop a rash while I am talking to you. And you start to scratch it, and it doesn't take you very long before you'll go to the local pharmacy and get some steroid or something to put on it. And if it doesn't go away in 2 days, you're going to call your doctor. And if in 2 weeks you'll be in a specialist office, you'll be at a dermatologist. Unfortunately, we treat our skin a lot better than we treat the mental health symptoms of our children. And so a symptom that is 10 years old or 6 years old that has affected a child's academic performance, their ability to socially engage, is significantly more difficult to treat, and it decreases the prognosis. So the exciting part is that when you put smart people together and they believe not only that you should think globally, but think truly out of the box. The Stavros Niarchos Foundation for Global Child and Adolescent Mental Health was formed and lives at the Child Mind Institute, but it's everywhere. As you're going to hear, that we started with the idea of Brazil and South Africa as the first two countries, but you're going to hear about work being done in Burundi and in Mozambique and in Pakistan. Usman, I think, will join us on the screen soon. Whether it was Queen Victoria or Winston Churchill who said the sun never sets on Great Britain, the sun never sets on the Child Mind Institute. So take that, Queen Victoria. So well, let me give you the next slide. Okay. So the numbers, as I said, are not good. It's 1 in 7 children in the world have a mental disorder. 75% of all psychiatric disorders begin before the age 18, and 80% with a diagnosis of a mental health condition do not get any type of treatment. And 90% of the kids, as I said, live in low and middle income countries. And so in 2019, we got the initial funding to start the Child Mind Institute, partnership for the Child and Adolescent Mental Health Initiative. But in 2023, this investment evolved into the SNF Global Center. So we do 6 pillars. First and foremost, remember, you can't go in and tell people what to do in their country. There's lots of people who are very smart, as I told you before, who know exactly what to do, but they might want to get some new ideas, but only if they want to get some new ideas will it work. So we do a global landscape mapping. We first figure out what is going on the ground in those countries. The second is you need to adapt everything, the implementation, the training, so it's multicultural for that country. And you need innovations in assessment and intervention. You can't do it the same way everywhere. And we're thinking out of the box. Some of the things that we didn't talk about earlier are the use of technology. We got funding from the state of California to develop the next generation of digital therapeutics, and now we're thinking about how can we translate some of those therapeutic journaling apps or some of the apps that we've developed to do behavioral activation for depressed kids. Are there ways of extending the healthcare team by using those kind of devices? And you need public awareness and engagement. As you're going to hear, the stigma is everywhere, but in some places it's much more firm and much more entrenched. And as long as that exists, it's very hard for kids to get help. And we've developed fellowship, and you're going to meet some of these amazing fellows, because the idea was that if we could get over 5 years, if we could get 5 research fellows, 5 outstanding research fellows who are in low and middle income countries, give them a bolus of funding, see about how they can get started with a new project, how they could then develop a network with the other 4 over the next 4 years of research fellows, how they could work with us and some of our colleagues at other institutions, and then we would do the same thing with clinical fellows and with communication fellows. There's no doubt we need journalists everywhere. As you know, you saw the seminar before on the words we use and how we talk about mental health, but we need local or national journalists who are talking about how real, common, and treatable mental health disorders are in children. And then last, these expert gatherings are very important. It gives everyone an exchange of ideas, and it also helps them with tremendous amount of support when they're in it, on the ground, alone, trying to really build a system or fight a system that's a barrier to getting kids help. So those are the 6 pillars. We're going to start now. I'm going to introduce you to 3 of our fellows, as well as one of our directors of youth engagement. And I think it's perfect to start with the director of youth engagement, since we just had the last panel about the voices of youth. Let me introduce you to Eduardo. He's the director of youth engagement for the SNF Global Center, and he's also the co-founder of Youth Peace Builders in Brazil. So I'm going to act like I'm his uncle or his father or his mother. He's actually a senior at Harvard University, and so everyone should be, you know, I'm sure his parents are very proud. But on top of everything else, Forbes magazine has listed him 30 under 30. He's all of 22 years old, and he gives me hope for the future. So why don't we start, Eduardo, with what motivated you to co-found Young Peace Builders, and how does mental health tie into the peace-building efforts in Brazil?
Thank you for your question, Harold, and the very kind words. What motivated me to act is that for many students, the school is no longer a place of learning. It's a place of fear and anxiety. So in Brazil, over 7 million kids and teenagers experienced some sort of violence inside their classrooms in the last few years. And while I was growing up, I could not accept that my educational environment was supposed to be filled with bullying, drug abuse, interpersonal violence, as early as I was 10 years old. So I started working with the prevention of youth violence in my early teenage years, passing through Brazil's Congress, the Association to Benefit Children in East Harlem, and also in regional departments of education in Brazil. But it was in 2022 that we co-founded Young Peace Builders. Our strategy is tackling school violence through a community-driven model. So in the most violent school environments, we invest in the students as catalysts of change by training them to be peace builders. And what started as a policy program in Brazil state with most school-based violence has now expanded to 8 different states, reaching annually from 15 to 20,000 students. And to your second question, Harold, mental health is at the heart of our approach, as we believe that there is no lasting peace without inner mental peace. So the first way that we approach mental health is by cultivating belonging. One of our signature initiatives is called We Miss You. So students send a heartwarming message to their peers that have been frequently missing school so that we can help prevent dropout. The second way that we approach mental health is by restoring hope. So students build murals of opportunities in their school, filled with academic and professional resources, so that their peers might be able to envision a future with brighter opportunities beyond current struggles. And on crisis readiness, we've been partnering with the SNF Global Center to build maps of mental health resources at the local and the national level so that easy access is available when needed. And finally, arts and community action clubs play a super important role. I know you're a big arts curator. I had the chance to visit the headquarters in New York, and I was fascinated by the pieces of art. And the fact is that art has the potential to turn conflict into expression and connection. So in one of our schools, the students decided to build a school band to play during school breaks because it was commonly associated as a moment of tension and conflict. So at its core, Young Peace Builders is about envisioning and working for a world where students can learn and thrive without fearing for their lives and well-being.
From a youth's perspective, what is missing in global mental health programs, and how can youth be brought more into decision-making?
I think that social innovation starts with disruptive creativity. But without good measures, every social innovation can end up either driving progress or even creating harm. So as I learned from Giovanni, in the literature today, the missing piece is not the lack of the vibrant energy of the youth, but the lack of measures of what success means. So we still don't know how to measure meaningful youth participation or mental health literacy in schools, for example. And I would argue that good measures are those that speak to what matters to students while also being science-based and culturally responsive. And reflecting about the second question here on how we can integrate youth into decision-making spaces, in the last years, I organized democracy summits across Latin America, where we brought together over 1,000 students to discuss about the most pressing challenges for the youth, including mental health. And there were 3 key lessons that I learned from these gatherings. The first one is about the role of debate for engagement. As we're here in Athens, the birthplace of democracy, we need to reflect about how civil discourse, youth-led civil discourse, can open new pathways on how we treat mental illness. The second lesson was about the importance of cross-cultural community building. So at every summit, we would host intercultural fairs where students would share their food, their music, their tradition with each other. And global mental health programs need to create similar spaces where the youth bring their local realities into global conversations to then translate global insights into their communities. And finally, I think there's something to be said about actionable outcomes. So too often, global programs engage the youth without providing a space in which they can implement real change. I think the most successful programs are those in which the youth is invited to participate, and they have to deliver a clear project, an outcome, a product, be it a policy proposal, a local mental health initiative in their school. And to wrap up in these next few months, I'm very glad to be coordinating youth engagement at the SNF Global Center. And our mission will be to make the lived experiences of the youth to be the driving force behind our work. And the way we're going to do that is by creating a global youth advisory council. And in this space, young leaders will be actively shaping discussions about the future of global mental health. So there is much more to come, and I'm very happy to have had this chance to learn and share from all of you.
Thank you, Eduardo. Our second speaker is Avit. He's a journalist, and he's the first SNF Global Center Communicator Fellow, and he's from Burundi. Avit, you play a key role in communicating mental health issues to the public. So what have you found to be the biggest barriers in media representation of child and adolescent mental health in Burundi and in similar settings?
Thank you for the great question. Actually, first of all, what I can say about the biggest barriers in the media representation of children and adolescent mental health in the Burundi and similar settings is that we have to come back a little bit and understand what is mental health. First of all, that it is among non-communicable disease. This means that it does not grab the attention of media people because they are running for breaking news or they are waiting for pandemics. But for mental health, it's like they are not there because it is like a silent killer. It is killing the people in a hidden way because media are not there. That's the first biggest barrier I have found. The second one I can talk about it is that, as the other sessions have highlighted, it is that we journalists, we are not really equipped enough, or we don't have that understanding of what is mental health. And then a journalist cannot report beyond his understanding. When you do not understand a subject, You cannot go in front of people and then report, tell them about it. You have, first of all, to have the knowledge, that skills, and then be able to communicate to the audience. Otherwise, you find yourself misreporting the subject, and therefore you will be like killing the audience or the population. That's the second one. The third one I can talk about is that, well, like in Burundi, we don't have information or data about mental health. Well, let me give you a simple example. The whole country of 12 million for now has only 4 psychiatrists. You understand that? No way you can find information. And I cannot talk about like a child psychiatrist. It does not exist. I've been asking in the whole country. They told me this one does not exist in the country. You understand that? Journalists, we are therefore, we cannot report something that we don't have evidence. We don't have data about it, because I will not say it is this and this way. I don't have any data to back up my reporting. That is the third barrier. What can I talk as the fourth barrier? It is that mental health in Burundi is really stigmatized, and it is often linked to witchcraft. It means that when someone shows symptoms of mental health disorders, instead of thinking about a mental health center, they will look for a pastor or a priest to pray for that person, or go to the traditional healers. You understand, this is another biggest challenge. The last challenge I can talk about in media representation, it is the lack of funding. Let me tell you how it is. For example, we have a national plan from the Ministry of Health of fighting against HIV. In this program, the Ministry of Health collaborates with media. It means that there is a funding for that program, and therefore media will also receive a part of funding so that they can promote that program. They can send a message to to reach a large number of people. But for mental health, this program does not exist. In that case, you understand that journalists or media professionals will not focus on something which maybe is not bringing something for their well-being as well. That's what I can talk about it, just trying to sum up about biggest barriers, because you have so many. Yeah.
So let's talk about strategies that can be used to balance these cultural sensitivities while advocating for global best practices in mental health reporting.
Talking about strategies to overturn maybe the situation, I can talk about some 4. The first one, it is all about equipping journalists. And this is very important. As I said, once journalists understand what is mental health, it will be easy for them to communicate, to tell people, to raise awareness about it in the community. And this is, I think, it must be an effective way of, an effective strategy of overturning the situation. The second one, it is the collaboration between mental health professionals and the journalists. Once you collaborate with mental health professionals, you get to understand, and therefore you can be able to transmit a clear message to the audience. That will be the second strategy, and I think it is very important. Another one that I have found it can be really effective, it is all about that journalists can promote stories of recovery, whereby we talk, we communicate to the audience that there are people who used to have mental health disorders, but they have been treated, and now they can give testimonies. Therefore, this can help to tell people that mental health, it is a curable disease. It is not witchcraft or something else from the superpower we don't know. That's another biggest way. The last one I can talk about, it is all about fighting against the stigma within the community. Because this has been shown that when a person used to have mental health disorders and he has been treated and he go back in the community, and then the community starts stigmatizing that person, he end up in what they call relapse. That's what I can say. Thank you.
Thank you. Let me introduce, it's my pleasure now to introduce our third speaker, who is Yusman. He's online. Trust me, he wished he was here, The world is complicated with visas today. He is a child and adolescent psychiatrist. He had a whole life working before a researcher, working for Wellcome Trust, so he knows how hard it is to get money because he used to give the money away. He is an excellent clinician as well. So Usman, welcome. In your research, and he is our first, by the way, SNF Global Researcher Fellow. What have you identified as the most pressing gaps in mental health services for children and adolescents and low and middle income countries?
Thank you so much, Harold. Can you hear me loud and clear?
Yes, we can. Yes, we can.
Perfect, great. I'm so excited to see you all here, and congratulations on actually organizing this so perfectly. Every time I relate with the SNF Center and the Child Mind Institute, it feels like my DNA really belongs there. So your slogan, like think local, think global, act local, is always like syncing so well with me, and I feel so privileged to be part of this group, which is actually doing the work that needs to be done. Coming to the question, as you have already said, that 90% of the children live in LIMICs, where only 10% of the trials related to child and adolescent mental health are taking place. And this is a statistic from about 10 years ago or 12 years ago, and which is still true to a great extent, but still in the past 10 years, there is a lot that has happened. And what that has told us is that we can train non-specialists, such as parents, teachers, other non-specialists such as graduates, to provide evidence-based services in low and middle income countries, because we know that we don't have specialists there, we don't have evidence-based treatments there. What we don't really know is that if those treatments work at scale. So there have been trials, there have been evidence-based programs, but those are isolated trials happening in small places. Even if they are big trials, they're not big enough to actually capture the real life essence of how it is like. So the real bottleneck that I feel is there is about the lack of evidence on the scalability and sustainability of the intervention programs. And this is where I think initiatives such as the Child and Adolescent Mental Health Initiative by SNF Center and the Child Mind Institute can play a big role. So I would say, if I have to put down my finger on one thing, it is about lack of evidence on the scalable integration and implementation of evidence-based interventions in low and middle income countries.
Let's go further with that. So how can data-driven strategies improve access to mental health care in very under-resourced settings?
Sure. So as we all know that when we are talking about mental health, there is no one-size-fits-all. But when we are talking about child and adolescent mental health, there is definitely no way that we can actually do no harm to the child without having a real-time data. So we definitely need data in terms of how to better identify early, how to intervene early, how do we monitor for the systems. We need these systems to be integrated into schools, into the primary health care, using technology to ensure the fidelity of intervention at scale, training the non-specialists, supervising the non-specialists, especially also now we know that, for example, CBT works, but we don't know what works, for whom, under what conditions and why, especially for child and adolescent mental health. And we cannot answer that question unless we have adopted a data-driven approach. We definitely need more innovative trial designs such to inform more personalized interventions, such as the SMART trials, for example, sequential, multiple assignment randomized trials. And they cannot happen unless we have tools which can inform those designs, unless we have research designs that can inform the treatments, and they're integrated into platforms such as schools and the primary health care, and the data is coming and informing it in real world. So I would say at this point in time, data is the key, integration into public health platforms is the key, and that is where the evidence would come to inform what works, for whom, under what conditions and why, and inform the scalability and sustainability of interventions.
Usman, thank you so much. Our last speaker is certainly not the least. This is Lydia. She is a psychiatrist in Mozambique, and she's the coordinator of the SNF Global Center Mozambique Clinical Fellows. They're a group of clinical fellows in Mozambique who, over the next 5 years, there'll be 3 every year who will be going to Brazil, learning about child and adolescent psychiatry, and then coming back the next year and getting teleeducation. Our hope would be over 5 years, we'll leave behind 9 child mental health trained individuals so that Mozambique can start their own training program. So it's really my pleasure to introduce Lydia. And my question for you is, how do you ensure mental health interventions rooted in Western psychiatric treatments with work in African healthcare systems?
Okay. I have been working for over than 20 years as a mentor in training psychiatrists in partnership with Portugal, and in recent years we work with Brazil in field for child and adolescent psychiatrists. And we have our first adolescent psychiatrist there is Helena Daniel. Yeah, she was a Giovanni student. Okay. Okay, what we used to do in Mozambique, we have a close collaboration with church and the traditional healers, because they are really the first point of contact for families with seeking for help for someone with mental or behavioral disorders, because they believe that if they go first the priest or the pastor, they will the priest will help them, the priest will help them, and the traditional healer too, because traditional healer used to give them the bath with some plants and do some vaccines, we can say vaccines, and they believe that after that, when they go to the hospital, the doctor can act better with that procedure first. And we used to collaborate with them for that. And when we prioritized the blended training model, which lasts 3 years, and then the international internship is from 2 or 3 years. And what we do before the candidates start specialization outside the country, they have clinical practices, general practices for 1 or 2 years of clinical general practices in secondary or tertiary level of health in Mozambique. And then they can start to study psychiatry. And where they are abroad, we push them to do a master's degree or PhD, because when they come back home, we want that they can develop a critical perspective on their working environment and use research as a tool to adapt their interventions based on evidence, and advocate with Ministry of Health to put it in plans and strategies for mental health. Is very important for us. And we think that, yeah, we have a good psychiatrist in Mozambique, but we are only 30 psychiatrists in Mozambique, and one is Helena. She is for children and adolescents, and we are 30 million of population. Yeah, we are very few, really. Yeah, we are very few.
So we talked about strategies to make the local
Yes.
workforce
Yes.
more effective. What have you been doing there? Because I think we could all learn from that example.
Yes, because we recognize that to train psychiatrists is long and costly, and we cannot reach the community with that with psychiatrists. What we did from 2007 until now is to train a middle-level professional for 2.5 years. We called them psychiatric technicians, and they work. Now we have around 400 of that professionals, and they work in secondary or tertiary level of unity level of health, and they work with communities too. They work at the hospital, but they go to the communities. And in their training, we include a strong public health component because they work with schools, with church, traditional healers, community leaders, and grassroots organizations. And they are trained to manage epilepsy because epilepsy in Mozambique is really a public health issues. Yeah, it's a public health issues. And then we teach them about the various stages of child development, and because they work with teachers, and then they can really guide teachers and parents and seek support from psychiatrists to help the children and adolescents. And for ensure sustainability and quality of their work, they receive supervision. Can be personal when we can, but sometimes we can't, and we use phones to supervise their work. And this is what we are doing now. And then they help us in efforts to combat stigma and discrimination, because we have a lot of stigma for mental health in Mozambique, and it's deeply rooted in our traditionals and our traditional beliefs. Yeah, it's that.
Thank you very much. Really, thank you. I think these are very good examples of how local action can bring global change for child and adolescent mental health. I hope you're as inspired as I am. This is year one, and in the same way that now I look back and think about how hard and how challenging it was when we started the Child and Adolescent Mental Health Initiative here in Greece. It is certainly more challenging when you're in countries that have different cultures, different stigma, different limitations, but also tremendous amount of creativity. So I hope that if you're inspired, you're going to collaborate with us. If you are a policymaker, if you are a clinician, you have ideas, please reach out to us. The Global Center is truly global, so we want to hear from you and think about the next chapter. It goes without saying, but it's necessary to say again, this work could not be done without the remarkable generosity and vision of the Stavros Niarchos Foundation, in particular, with great pride, my friend Andreas Dracopoulos. So I want to thank him and thank everyone at SNF for all the hard work. Here in the front row, we have Panos and Eliana. If I start, I'll be here for another half an hour saying thank you to everyone. But this is changing the lives of so many children that we might never see or may never know, but their lives will be changed in very, very important ways. So thank you very much, and thank you for joining us today.